What made you move from traditional clinical physical therapy to your own private practice?
Yeah. So I've been a PT almost 7 years now, and I've had a chance to work in several different outpatient clinics. And over the years, reimbursement from Medicare and all the insurance companies keeps dropping pretty drastically, actually. And to kind of combat that, what clinics are having to do is increase the patient load. So increasing how many patients PTs are seeing daily or hourly to make up for that drop in reimbursement. So I was just seeing how my own personal patient care, I felt like the quality was dropping because I wasn't able to spend as much time with my patients. So that's one reason that I kind of decided to go out on my own. I decided to go with the kind of out-of-network cash-based PT model because that allows me to spend 1 full hour with my patients. I don't have any text. I don't work with them for 15 minutes and pass them off to someone else to do the exercises. I feel like it allows my quality of care to be a lot better, have a better relationship with my patients. They can ask me, they've got a whole hour to ask questions and all of that. So depending on insurance and out-of-network benefits, if you come see me, there is a possibility that you could get some reimbursement back from your insurance. Every case is different, though.
Yes, that's awesome. That's awesome that it really shows how you care about your patients. That's why you want to do this.
Yeah.
It's a bit more entrepreneurial side, you know. You have to do your marketing and do your own administrative. Yeah, so it's and you're the technician. So.
Exactly.
Yep, and that's true. I understand, but that's great. I think you'll find the people who wants more care. Who doesn't want just talk for 10 minutes and get passed on.
Exactly.
And I noticed how you treat the patient as a whole body. It's not just what the insurance is just paying. Yeah.
Yep.
So that's pretty good. Yeah.
Yeah.
And can you also maybe share to us what are you looking for when you assess a patient, or maybe you could use me as your guinea pig.
Yeah.
Let's say I'm new, then I mentioned I have back pain. So what would you normally do in your assessment?
Yeah. So typically I just start with kind of the story. When did it start? How long? When do you feel the pain? Kind of the basic stuff. But I always want to watch how patients move. I want to see how they bend forward if it's back pain, or how are they going to pick something up off the floor? How do they walk? Are they already developing compensations with their gait pattern that could be affecting the back too? Kind of like addressing like a chicken and egg situation. Is it something else that caused the back pain, or is the back pain causing new compensations to develop? Because we want to address any of those faulty movement patterns as quick as possible, because it's just going to cause other issues. So generally, if you have for example, a problem with the knee, or you've got knee pain, the joints above and below it are going to try to compensate in whatever ways they can. So we always want to fully assess the areas just above and below the areas that people have the pain.
Yeah, like people are wondering, how come she's looking at my ankle? My back is here, or my knee, or so
because it's all connected.
You treat it as a whole, as a unit. So like, can you ask me to do stuff? I won't take any offense if you say anything. So anything you want me to do like to show, am I dysfunction or there's imbalance?
So first thing I would just have them do is, how far can you reach forward, keeping your knees fairly straight? Good. And so I would be looking to see kind of the movement through their low back. Do they have a smooth kind of curve there? Are they flat in areas? Are they getting any of their symptoms, shooting pains with that motion there? Then I look at side bending. Is it equal to both sides? Is one side extremely restricted or painful versus the other? Good. So fairly equal there. Then I look at rotation. So hands across your chest. And then you're going to try to turn and look behind you. Good. So I'm looking for symmetry with this as well. He's doing actually a pretty good job of isolating the rotation. A lot of times I'll hold people's hips so that I can see true rotation through the spine. And rotate one more time to the left side.
Yeah, I can feel
a little restricted
here.
That way.
Yeah.
Good. And then hands on your hips and you're going to go backwards.
Okay, that's hard.
Good. Yep, so we already know with his history, extension is a problem sometimes. Yeah. So from this assessment, I saw a little bit of restriction with left rotation. Then we've got to figure out, is it joint related or is it soft tissue muscle related? So to do that, it would be some kind of hands-on assessing each level of the spine, and then feel of the kind of the back muscles too.
Okay.
Yeah.
Awesome. So I pass.
You did.
So that's a good thing. I can't even bend over before. So like I was here. So thank you to Pilates.
Yes.
Okay, but thanks Jenny for sharing to us, how you do things and how you help your patients.
Yeah, thank you.
Okay.